Have you ever noticed subtle changes in your body, persistent bloating, unexplained weight loss, or even a nagging backache, and brushed them off as just getting older? What if those seemingly minor symptoms were your body's way of sounding an alarm for something far more serious? In this video, we're diving deep into the 10 early warning signs of ovarian cancer that are often overlooked but could save your life if detected early. These aren't just ordinary symptoms. They're silent cries for help from your body. From persistent abdominal bloating to chronic fatigue, each of these signals carries a message you can't afford to ignore. Why should you watch until the end? 1. Abdominal bloating. Learn how this seemingly harmless symptom could be an early indicator of ovarian cancer, distinct from the occasional bloating after a big meal. 2. Pelvic or abdominal pain. Understand why persistent pain in these areas is never just cramps and when to take it seriously. 3. Difficulty eating or feeling full quickly. Discover why changes in appetite and fullness might be connected to something far deeper than stress or diet. 4. Urgent or frequent urination. Recognize how this seemingly minor inconvenience could be a red flag linked to your bladder's proximity to the ovaries. 5. Unexplained weight loss. Understand why sudden weight loss might be a sign of your body fighting an invisible battle. 6. Chronic fatigue. Discover why this unrelenting exhaustion is more than just a busy life, and how it's tied to your body's fight for survival. 7. Lower back pain. Learn why this common ailment could be a symptom of something far more significant when it doesn't respond to rest or treatment. 8. Changes in bowel habits. Identify how sudden disruptions in your routine could signal underlying issues. 9. Menstrual irregularities. For premenopausal women, find out how changes in your cycle might indicate ovarian health concerns. 10. Pain during intercourse. Gain insight into why this overlooked symptom could be a critical warning sign. Stay with us. By the end of this video, you'll not only know how to spot these symptoms, but also why early action is crucial. Ovarian cancer is often referred to as the silent killer, but the truth is, your body is always speaking to you. The question is, are you listening? Don't wait until it's too late. Watch until the end and take control of your health today. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. First, abdominal bloating. Abdominal bloating, though often dismissed as a benign and temporary discomfort, can be a harrowing early warning sign of ovarian cancer, a silent adversary that claims the lives of countless women each year. This symptom is one of the most commonly overlooked, its insidious nature hiding behind the veil of everyday ailments like overeating, indigestion, or hormonal changes. Yet, beneath its seemingly mundane facade lies the possibility of a far more sinister condition. This type of bloating arises when fluid begins to accumulate in the abdomen, a condition known as ascites, caused by the spread of cancerous cells. Unlike the temporary swelling that often follows a heavy meal, bloating associated with ovarian cancer is persistent, unyielding, and progressively worsens over time. Imagine the creeping discomfort of tightness that starts mildly but grows into a relentless sensation of fullness, even after eating little or nothing. Clothes that once fit comfortably now feel suffocating, and your abdomen, once familiar, begins to feel alien, distended, heavy, and uncomfortably enlarged. For many women, this sensation is accompanied by a heavy, dragging feeling deep in the lower abdomen, as though carrying an unseen weight. The discomfort can overshadow daily activities, making simple tasks feel burdensome. Yet, because this bloating is often gradual, it's easy to rationalize. Perhaps it's just something I ate, maybe it's water retention, or this is just part of getting older. These assumptions, though understandable, can delay life-saving action. What makes this symptom so deceptive and dangerous is its familiarity. Many women experience bloating at various points in their lives due to diet, stress, or menstrual cycles. However, The key difference lies in persistence. Ovarian cancer bloating doesn't come and go. It lingers, growing more pronounced with each passing week. It's not a fleeting annoyance, it's a warning sign. This relentless bloating can also be accompanied by other subtle changes in the body, such as a loss of appetite or difficulty eating, even small portions. The tight, distended sensation may lead to feelings of lethargy and frustration, as if the body is silently working against you. Often, this is compounded by feelings of confusion and worry. Why won't this go away? Ignoring or normalizing these signs can have devastating consequences. Persistent bloating isn't just an inconvenience, it's your body's way of signaling that something is deeply wrong. When left unaddressed, the condition causing it can advance unchecked, making treatment more challenging. If you've been experiencing unexplained bloating that lasts for weeks, particularly if it's accompanied by a sense of heaviness or noticeable changes in your abdomen, don't hesitate. This is not the time to delay or second-guess yourself. A visit to the doctor could be the difference between catching ovarian cancer in its early stages, when it is most treatable, or facing a much more daunting battle. Early detection is key. The earlier ovarian cancer is identified, the greater the chances of successful treatment and survival. While bloating might seem like an ordinary part of life, it's crucial to recognize when it veers into the extraordinary. Trust your instincts. Your body speaks to you in whispers before it shouts. Listen closely and act swiftly. The discomfort you feel today could be the symptom that saves your tomorrow. Second, pelvic or abdominal pain. Pelvic or abdominal pain is a symptom that many women might brush aside, attributing it to ordinary cramps, digestive issues, or stress. However, when such pain appears without an obvious cause, it can be a harrowing early indicator of ovarian cancer, a disease often referred to as the silent killer, because its symptoms are subtle and easily overlooked. At first, this pain may feel mild, resembling the kind of discomfort you might associate with bloating, menstrual cramps, or mild indigestion. It might come and go, making it easy to dismiss as something temporary. But unlike ordinary cramps, the pain associated with ovarian cancer doesn't subside with time or follow any predictable cycle. Instead, it lingers, growing more persistent and often more intense. The pain can manifest in various forms: a sharp, stabbing sensation that seems to strike without warning, a dull and unrelenting ache that gnaws at your lower abdomen, or a bothersome pressure that makes everyday movements feel difficult. Some women describe it as a deep, pulling sensation in the pelvis, as though an invisible weight is bearing down on their lower stomach. As the disease progresses, this discomfort may spread beyond the abdomen. Tumor growth and the pressure it exerts on surrounding organs, along with the spread of cancer cells to nearby tissues, can trigger a cascade of pain throughout the body. Women may experience lower back pain that radiates down into the thighs, often mistaken for muscle strain or sciatica. This nerve-related pain can become debilitating, interfering with sleep, mobility, and daily activities. The emotional toll of this persistent pain can be just as profound as the physical discomfort. The constant ache can lead to frustration, anxiety, and a gnawing fear of the unknown. It's easy to dismiss this symptom as nothing serious, especially when life is busy or other responsibilities demand attention. Yet, this kind of pain is not normal, nor should it be ignored. The cause of this pain lies in the nature of ovarian cancer itself. As tumors grow, they place pressure on the abdominal organs, compressing tissues and nerves. This pressure can disrupt normal bodily functions and lead to a constant state of irritation within the pelvis. Cancer cells invading nearby areas exacerbate this discomfort, turning what might have been mild aches into severe, unrelenting pain. If you find yourself enduring new, unexplained pain in the lower abdomen or pelvis, especially if it lasts for several weeks or intensifies over time, it's critical to seek medical attention. This isn't the type of discomfort that can be managed with over-the-counter remedies or wishful thinking. Persistent pain in this area is a red flag that demands investigation, as it could be one of the earliest signs of ovarian cancer. Time is of the essence when dealing with this silent yet aggressive disease. Early detection significantly improves treatment outcomes, offering hope and a chance for recovery. Listening to your body and acting on its signals, no matter how subtle or easily dismissed, can be life-saving. Don't let this pain go unaddressed. Seek help and give yourself the best possible chance to confront and overcome whatever lies ahead. Third, difficulty eating and feeling full quickly, a silent cry for help. Among the many subtle and easily overlooked symptoms of ovarian cancer, difficulty eating or feeling full too quickly stands out as one of the most deceptive. It is a quiet, almost invisible warning sign that can blend seamlessly into the background of daily life, often misinterpreted or dismissed. This unsettling symptom occurs when a growing tumor begins to press against the stomach and intestines, reducing their capacity and altering how your body handles food. What might initially feel like a mild inconvenience can grow into a persistent, life-altering struggle. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Picture yourself sitting down at the table, genuinely hungry and ready to enjoy a meal. Yet, just a few bites in, you are overwhelmed by an unnatural sensation of fullness. The hunger that brought you to the table is abruptly replaced by discomfort or even bloating. Your stomach feels tight, as though there is no more room for food, and the joy of eating is replaced by a gnawing unease. For some, this sensation might be accompanied by nausea, a vague heaviness in the abdomen, or even sharp, shooting pain. Over time, the simple act of eating can transform from a source of nourishment and pleasure into an experience clouded by dread. Many women brush off this alarming symptom, rationalizing it as the result of harmless causes, perhaps a temporary digestive issue, stress, or even the natural changes that come with aging. It's easy to tell yourself that you've just eaten too quickly, or that your body is adjusting to a change in your diet. However, when you find that this sensation persists meal after meal, or you're consistently eating far less than usual and still feeling full too quickly, it's important to take notice. This symptom becomes particularly concerning when paired with unintentional weight loss. Suddenly, you might notice that your clothes are fitting more loosely, or friends and family might comment on how thin you look. The changes in your body may feel out of your control, leaving you confused and unsettled. While other conditions, such as acid reflux, gastritis, or stomach ulcers, might cause similar symptoms, these explanations should not be accepted at face value without a proper medical evaluation. Persistent changes in your appetite and how your body processes food are not normal and should never be ignored. The emotional toll of such a change can also weigh heavily. You may find yourself withdrawing from social situations that involve food, family dinners, nights out with friends, or celebrations, because the act of eating has become a source of anxiety. The fear of bloating, nausea, or pain can cause you to avoid meals altogether, leading to further weight loss and a decline in your overall well-being. This isolating experience can feel like a spiral, pulling you further from the people and activities you love. Recognizing and responding to this symptom is not only about addressing your physical health, but also about reclaiming your quality of life. It is crucial to listen to your body and take its signals seriously. Early detection of ovarian cancer can make a significant difference in treatment outcomes, and even subtle, seemingly harmless changes like difficulty eating deserve attention. If you find yourself experiencing these symptoms, feeling full quickly, eating far less than normal, or dealing with persistent bloating or discomfort, it's time to prioritize your health. Seek medical advice promptly, and don't let fear or self-doubt keep you from taking action. The earlier you confront these changes, the greater your chance of addressing any underlying issues effectively. Remember, your body's signals are not random, they are messages. Acknowledging and addressing them with care and urgency is not only a step toward protecting your physical health, but also a powerful act of self-respect and love. By seeking help, you give yourself the opportunity to overcome what could otherwise remain an invisible threat. Your vigilance and courage to act are not only important, they are life-saving. Fourth, urgent or frequent urination, a subtle call for attention. The need to urinate more frequently or urgently than usual might seem like a minor inconvenience, but it can also be a silent warning sign of ovarian cancer. This symptom often arises when a growing tumor in the ovaries presses against the bladder, reducing its capacity and creating a sensation of fullness that prompts frequent trips to the bathroom. What starts as a slight annoyance can escalate into a persistent, disruptive issue that interrupts daily life. Imagine yourself going about your day, only to find that the urge to urinate strikes far more often than usual. Whether you're in the middle of a meeting, running errands, or trying to relax at home, you suddenly find yourself seeking out the nearest restroom. Even at night, when your body should be resting, you may find yourself waking up repeatedly with an urgent need to empty your bladder. The frustration grows when these frequent trips result in the release of only a small amount of urine, leaving you feeling as though your bladder is never truly empty. While many women dismiss the symptom, attributing it to aging, childbirth, or common issues like urinary tract infections, UTIs, or an overactive bladder, it's essential to look beyond these surface-level explanations. The sudden onset of frequent or urgent urination, particularly when it's paired with other symptoms like pelvic pain, bloating, or changes in appetite, should not be ignored. These combined signs may indicate a deeper issue, one that requires immediate medical attention. For many, the emotional toll of this symptom can be as challenging as the physical discomfort. The constant need to find a bathroom can disrupt your daily routine, interfere with your social life, and even lead to embarrassment or anxiety in public settings. You might find yourself planning outings and activities around restroom availability, limiting your freedom and enjoyment. This seemingly small issue can cast a large shadow over your quality of life. It's important to note that frequent urination can have a variety of causes, from dehydration to bladder infections to hormonal changes. However, when this symptom appears suddenly, without an obvious explanation, and persists over time, it's a red flag that should not be overlooked. The bladder's close proximity to the ovaries makes it vulnerable to the pressure exerted by a tumor, and this physical relationship underscores the importance of paying attention to urinary changes. Women often downplay this symptom, especially if they've had children, assuming it's a natural consequence of childbirth or aging. However, ovarian cancer has a way of disguising itself as common, everyday issues, which is why it's often referred to as the silent killer. A sudden and unexplained increase in the frequency or urgency of urination deserves more than a passing thought. It calls for a closer look at your body's signals and a proactive approach to your health. If you find yourself experiencing this symptom, coupled with bloating, pelvic discomfort, or a feeling of fullness after eating, don't hesitate to consult a doctor. Early detection can make a significant difference in treatment outcomes, and addressing this symptom could lead to uncovering an issue that might otherwise remain hidden. Listening to your body is an act of self-care and empowerment. By acknowledging and addressing even the most subtle changes, you're taking control of your health and advocating for your well-being. Don't let fear or uncertainty hold you back. Your vigilance could be life-saving. Fifth, unexplained weight loss, a hidden alarm bell. Losing weight without trying might initially seem like a welcome surprise, especially for those who have struggled with their weight in the past. However, rapid unintentional weight loss can be a silent but serious warning sign of ovarian cancer, one that demands immediate attention. This unexpected change often goes hand in hand with other subtle symptoms, such as a loss of appetite and the distressing sensation of feeling full after just a few bites, both hallmark indicators of ovarian cancer. As cancer develops, it begins to demand a significant amount of energy from the body. The immune system works overtime to combat the disease, burning calories at an accelerated rate even when you're at rest. At the same time, the spread of cancer cells disrupts the body's natural ability to process food, leading to malabsorption of vital nutrients and a gradual decrease in both fat and muscle mass. This combination of factors creates a perfect storm for noticeable and unexplained weight loss. Imagine stepping on the scale one day and realizing you've lost several pounds without any effort. While this might initially feel like a small victory, it can quickly become a source of concern when the numbers on the scale continue to drop. Clothes that once fit perfectly may start to feel loose. Your reflection in the mirror may show a gaunt face and thinner limbs, and you may feel a lingering sense of fatigue or weakness that's difficult to shake. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. This kind of weight loss is particularly alarming when it happens rapidly or without any clear reason. For instance, losing more than 5% of your body weight within a short period, especially if you haven't changed your diet or increased your physical activity, is a clear sign that something is wrong. While it's natural to consider more benign explanations like stress, changes in routine, or hormonal shifts, it's essential to remain vigilant. When this symptom is paired with others, such as persistent bloating, pelvic discomfort, or frequent urination, it can be an early indicator of ovarian cancer. The emotional impact of unexplained weight loss can also be significant. Initially, it may bring fleeting joy or relief, but as the pounds continue to slip away without explanation, a sense of unease can set in. You might find yourself worrying about what's happening inside your body, feeling overwhelmed by uncertainty and fear. This emotional toll can weigh as heavily as the physical changes, affecting your overall quality of life. It's also important to acknowledge how easily this symptom can be overlooked or dismissed. Many people attribute unintentional weight loss to lifestyle factors, aging, or temporary stress. However, ovarian cancer often disguises itself as common, everyday issues, making it crucial to listen to your body and take note of persistent or unexplained changes. If you notice your weight dropping without a clear cause, don't ignore it. Consult a doctor, especially if the weight loss is accompanied by other symptoms such as bloating, pelvic pain, changes in appetite, or urinary urgency. These signs, when taken together, paint a clearer picture of what might be happening and can lead to an earlier diagnosis and better treatment outcomes. Your body has a remarkable way of communicating when something is wrong. Unexplained weight loss is not just a random occurrence, it's a message that deserves to be heard. By seeking medical advice and addressing the symptom with urgency, you're taking an active role in safeguarding your health and well-being. Early detection can be life-saving, turning what could be a devastating diagnosis into an opportunity for treatment and recovery. Trust your instincts and take action, because your life and health are worth it. Sixth, chronic fatigue, the quiet thief of vitality. Fatigue is a familiar sensation to most, often dismissed as a natural consequence of a busy day or poor sleep. However, the fatigue associated with ovarian cancer is different. It is a relentless, overwhelming exhaustion that permeates every aspect of life. This is not the kind of tiredness that can be remedied with a good night's sleep or a relaxing weekend. It's chronic, unyielding, and can leave you feeling as though the energy you once relied on has been drained away. This type of fatigue creeps into your daily routine, transforming even the simplest activities into Herculean tasks. Climbing a flight of stairs may leave you breathless, carrying groceries might feel insurmountable, and even getting out of bed in the morning can require immense effort. Despite sleeping longer than usual, you may wake up feeling as though you haven't rested at all, your body and mind weighed down by an inexplicable heaviness. The root of this fatigue lies in the body's battle against cancer. Fighting the disease requires a tremendous amount of energy, depleting the body's reserves and leaving little for day-to-day functioning. Additionally, ovarian cancer often disrupts the production of red blood cells, leading to anemia, a condition that further exacerbates feelings of weakness and exhaustion. With fewer red blood cells to carry oxygen throughout the body, simple movements and activities can feel disproportionately draining. The emotional toll of chronic fatigue cannot be understated. The exhaustion extends beyond the physical, infiltrating your mental and emotional well-being. You might find it difficult to focus, concentrate, or maintain your usual optimism. Social interactions may feel like a burden, and hobbies or activities you once enjoyed can lose their appeal. This persistent fatigue can lead to feelings of frustration, isolation, and even despair, as it silently robs you of the energy and joy you once took for granted. While fatigue can stem from various causes, such as stress, lack of sleep, or thyroid disorders, the type of exhaustion associated with ovarian cancer stands apart. It is severe, unrelenting, and often accompanied by other symptoms such as unexplained weight loss, bloating, pelvic discomfort, or changes in appetite and urination. Recognizing the persistence and intensity of this fatigue is crucial. It's your body's way of signaling that something deeper may be at play. Many women dismiss this kind of exhaustion, attributing it to their busy lives, aging, or other health conditions. However, when fatigue becomes so pervasive that it interferes with your ability to function and enjoy life, it's time to take a closer look. Pay attention to patterns. Does the fatigue persist even after a full night's rest? Does it worsen over time? Is it accompanied by other unexplained changes in your body? If you find yourself experiencing this level of exhaustion, don't ignore it. Consult a doctor and discuss your symptoms in detail. Chronic fatigue, when combined with other signs of ovarian cancer, can be an early indicator of the disease. Early detection is critical, and addressing this symptom with urgency can lead to quicker diagnosis and treatment. Your energy is more than just a measure of physical health. It's a reflection of your body's overall well-being. Chronic fatigue is not something to accept or tolerate without understanding its cause. By seeking answers and taking action, you're not only advocating for your health, but also reclaiming the vitality and strength you deserve. Listen to your body, trust your instincts, and remember, even the quietest symptoms can hold the loudest truths about your health. 7th, lower back pain, a persistent and troubling sign. Lower back pain is a common ailment that many people experience at some point in their lives. However, when it appears without a clear cause and persists despite rest or treatment, it could be a subtle warning sign of ovarian cancer. Unlike back pain caused by strain, poor posture, or physical activity, this discomfort is often chronic and unrelenting, making it stand out as a symptom worth investigating. This type of pain may start as a mild ache, something easy to dismiss, but over time it intensifies and becomes more constant. The underlying cause often lies in a malignant tumor in the pelvic region pressing against nerves, muscles, or other tissues in the back. In some cases, fluid accumulation in the abdomen, a condition known as ascites, adds pressure to the lower spine, amplifying the discomfort. Imagine carrying an invisible weight in your lower back, one that refuses to ease no matter how much you stretch, rest, or change your position. This pain doesn't fade after a good night's sleep or a relaxing massage. It lingers, creating a dull, aching reminder that something isn't quite right. It may radiate to the hips or thighs, further complicating the experience and making everyday movements, like bending or walking, more challenging. While occasional lower back pain is often caused by benign issues like sitting too long or minor injuries, the key difference here is persistence and severity. If the pain is continuous, unexpected, and unrelated to any obvious cause, it's essential to consult a doctor. Persistent back pain accompanied by other symptoms, such as bloating, pelvic discomfort, or changes in appetite, could point to an underlying issue that requires urgent medical attention. 8th, changes in bowel habits, a disruption in your routine. Bowel habits can be surprisingly sensitive to changes in your body, and when they shift without explanation, it's a sign that something may be amiss. For women with ovarian cancer, these changes often result from a tumor pressing against the intestines, disrupting their normal function and creating noticeable differences in how the digestive system operates. You might experience constipation or diarrhea that seems to come out of nowhere. Some women notice a pattern of alternating between the two, leading to frustration and discomfort. Your stools might change in consistency, becoming unusually firm or loose, and even after using the bathroom, you might feel as though your bowels aren't completely empty. This incomplete evacuation can leave you feeling bloated and uneasy, compounding the physical and emotional distress. Although changes in bowel habits can often be attributed to diet, stress, or common conditions like irritable bowel syndrome, IBS, these causes usually resolve with time or treatment. Persistent or unexplained changes, however, demand closer attention. When paired with other symptoms such as pelvic pain, bloating, or fatigue, these disruptions can signal a deeper issue that requires immediate investigation. Listening to your body's signals, no matter how minor they seem, can be life-saving. If you notice consistent changes in your bowel habits that last for more than a few weeks, don't brush them aside. A thorough evaluation by a doctor could uncover an underlying issue early, greatly improving the chances of effective treatment. If you are still watching this video and find these lessons useful, Please comment number 3 below to let me know that you are still watching this video with me. 9th. Menstrual changes. A disruption in nature's rhythm. For women who have not yet reached menopause, menstrual irregularities can be an early red flag for ovarian cancer. The ovaries play a critical role in regulating the menstrual cycle, and when they are affected by cancer, the resulting changes can be significant. These abnormalities might include heavier or lighter periods than usual, irregular cycles, or bleeding between periods. Menstrual cycles that once ran like clockwork may suddenly become unpredictable. You may find yourself caught off guard by unexpected spotting, or your period might arrive much earlier or later than anticipated. The flow could change dramatically, shifting from light to excessively heavy, or vice versa. Pain, too, might become a more prominent feature, with periods causing severe pelvic discomfort that wasn't present before. For some women, an abrupt halt in their menstrual cycle, without a known cause such as pregnancy or menopause, can be particularly alarming. It's natural to consider other explanations for menstrual changes, such as stress, weight fluctuations, or the effects of hormonal contraceptives. However, when these changes persist or occur alongside other symptoms, such as bloating, fatigue, or lower back pain, it's important to take them seriously. These disruptions are not simply inconvenient, they could be an early sign of ovarian cancer. If you experience significant or persistent changes in your menstrual cycle, don't delay in seeking medical advice. A thorough examination can help identify the root cause of these changes, whether it's hormonal imbalance, another benign issue, or something more serious like ovarian cancer. Acting swiftly could make all the difference in addressing the problem early. Trust your body's signals. Lower back pain, changes in bowel habits, and menstrual irregularities may seem like isolated inconveniences, but when viewed together or alongside other symptoms, they can paint a clearer picture of what's happening inside your body. Ovarian cancer often presents with subtle, easily dismissed signs, making it all the more crucial to stay vigilant. If you notice any of these symptoms, especially if they persist or worsen over time, trust your instincts and consult a healthcare provider. Early detection and treatment could save your life. 10th. Pain during intercourse. A hidden and overlooked signal. Pain during intercourse, medically known as dyspareunia, is a deeply personal and often distressing symptom that many women may experience at some point in their lives. However, when this discomfort is persistent, unexplained, or felt deep within the pelvis, it could be a warning sign of ovarian cancer. Unlike surface-level pain caused by temporary issues like vaginal dryness, this type of discomfort often stems from deeper, more serious concerns. The pain associated with ovarian cancer typically arises when a tumor in the ovaries exerts pressure on nearby pelvic organs, such as the vagina, bladder, or rectum. This pressure can make sexual activity uncomfortable or even unbearable, transforming what should be a source of intimacy and connection into a source of anxiety and distress. For many women, the pain may not be limited to intercourse. It can linger afterward or emerge during routine activities like sitting or a pelvic exam, adding to the overall discomfort and sense of unease. This pain can range in intensity, from a dull, nagging ache to sharp, stabbing sensations that make intimacy impossible. The emotional impact of such pain is profound, often leading to feelings of frustration, embarrassment, or sadness. Many women may hesitate to discuss these issues with their partners or healthcare providers, fearing judgment or dismissal. This reluctance to speak up can delay diagnosis, allowing underlying issues to progress unchecked. Unfortunately, pain during intercourse is frequently misattributed to less serious causes, such as hormonal changes, infections, or age-related vaginal dryness. While these are valid explanations in many cases, persistent and unexplained pelvic pain, especially when accompanied by other symptoms like bloating, fatigue, or changes in bowel or urinary habits, demands closer attention. It's crucial to recognize that not all discomfort is normal or benign. Some women may dismiss this symptom, believing it's a natural part of aging or assuming it's related to past experiences or lifestyle changes. However, persistent pain that disrupts your ability to engage in intimacy comfortably and confidently is not something to ignore. It's a signal from your body that deserves to be heard and addressed. If you're experiencing deep pelvic pain during intercourse, take note of its frequency, intensity, and any accompanying symptoms. Be honest with yourself and your healthcare provider about the impact it's having on your physical and emotional well-being. Early intervention could make a significant difference in diagnosing and addressing the underlying cause. Your comfort, intimacy, and health are important. Pain during intercourse should never be accepted as inevitable or ignored, especially if it's new, persistent, or unexplained. Trust your instincts, advocate for your well-being, and seek medical attention to uncover the root of the problem. By addressing this symptom promptly, you're taking a vital step towards safeguarding your health and reclaiming your quality of life. So, what have you learned from today's video? Have any of the symptoms we discussed resonated with you or made you reconsider subtle changes in your own body? We'd love to hear from you. Comment below with one thing you've learned and how you plan to bring it into practice in your life. Remember, sharing your insights might inspire someone else to take action, too. If you found this video helpful, please take a moment to like, share, and subscribe to our channel. Your support helps us continue creating life-changing content and spreading awareness about important health topics. Together, we can empower more people to prioritize their well-being and live healthier lives. Thank you for watching, and don't forget to hit the notification bell so you never miss an update. Take care of yourself, listen to your body, and stay healthy.